Let us now discuss the disturbance of blood. This condition has two main categories: insufficiency of blood and disturbance of blood circulation. The latter comprises blood stasis due to retarded blood flow or overheating of blood, leading to accelerated blood flow and hemorrhage. Blood insufficiency. In this condition, the volume of blood is insufficient. If blood is unable to provide adequate nourishment to the body, the pathological effects are similar to those of insufficient blood volume. Reduction of blood volume may be caused by massive loss of blood without sufficient replenishment, or when deficiency of the spleen and stomach leads to malnutrition, so that these organs are unable to transform food essence into blood adequately. Blood insufficiency can also occur in cases of chronic consumption due to prolonged illness. Reduced nourishment of organs and meridians by blood can cause reduction in their functions. Clinically, this is manifested by symptoms of deficiency, either regionally or systematically. Thus, there may be a pallor and loss of luster of the complexion, the lips, the tongue, and the nails. There may be dizziness or vertigo, sustained palpitations of the heart, and shortness of breath and weakness. There may be numbness of the hands and feet and stiff joints. There may be dryness and irritation of the eye and blurred vision. Blood stasis. This is a pathological condition of retarded or impeded blood circulation or even gelling of blood. There are 5 main circumstances that produce blood stasis. Qi stagnation can cause obstruction of blood circulation. Qi deficiency can retard blood circulation. Accumulation of turbid phlegm in the meridians can block the blood vessels. Invasion of blood by the cold disease evil can induce gelling of blood. Invasion of blood by the heat disease evil can, in certain circumstances, also induce stasis of blood. Once brought about, blood stasis can further impede the movement of qi, so that qi impedance and blood stasis enter into a vicious cycle of mutual aggravation. Since impeded circulation is the main pathological mechanism underlying blood stasis, when static blood affects specific organs or regions of meridians, it can cause blockage of meridians with pain and swelling. At the same time, there may be darkening of the complexion, a dry and scaly skin, cyanotic lips and tongue, ecchymosis, and telangiectasis. Overheating of blood. In general, overheating of blood is a condition of heat in the blood level of warm diseases and can propel blood to circulate more rapidly than normal or cause blood to flow abnormally. This condition can come about in several ways, including exogenous heat evil entering into blood and exogenous cold evil invading the interior and transforming into heat. The commonly seen progression of heat illnesses into the nutritive level or blood level of warm illnesses belongs to this type of pathological change. Additional causes include mental depression, as well as the passions transforming into fire and blazing endogenous fire accumulating in the blood level. Since warmth propels blood circulation, overheating of blood accelerates circulation. When there is heat in the blood level, then the yin fluids are easily damaged. In severe cases, there may be bleeding. Hence, the pathological manifestation of blood overheating of blood characteristically includes excessive consumption of blood, damage to yin, and hemorrhage, in addition to fever. Hemorrhage. Hemorrhage occurs mainly when the vessels are damaged or when qi is deficient and unable to control blood flow. It can come about in several ways. Mainly, it occurs as a result of the abnormal flow of qi, scorching of the vessels by fire, a traumatic injury to the vessels. Because the blood vessels reach every part of the body, bleeding can occur at any place. The symptoms vary with the location of the hemorrhage. For example, injury to the lung can cause hemoptysis. Injury to the stomach vessels can cause hematemesis or melena. Injury to the large intestine vessels can cause hematochezia. Injury to the bladder or urethra vessels can cause hematuria. Injury to the vessels associated with the Chong and Ren meridians can cause metrorrhagia. Injury to the nose can cause epistasis. Hemorrhage can also occur when prolonged illness impairs spleen Qi. This leads to failure of the spleen to control blood, which in turn allows blood to extravasate, as in subcutaneous hematoma, for example. Thank you for listening.